Hello, my name is Marc Sakoda and I'm a chiropractor here at Transcription is Chiropractic, but I also do a technique called ART, which is active release technique. Basically it's for more of the muscles, ligaments, and tendons. A lot of people when they think of chiropractor they think of just manipulating the spine, but I work a lot with athletes on their muscles, ligaments, and tendons, and that's where the ART comes into place. With CrossFitters, because we're doing a lot of motion, as you know with any kind of bodybuilding or CrossFit, you will break down muscle and create a little bit of inflammation, which is supposed to happen. And then that's how your muscles grow. Basically scars down and then it rebuilds. And so what can happen over time is if you continue to do that process of breaking down, you create scar tissue, and that scar tissue stays inside the muscle. And that scar tissue decreases the flexibility of that muscle and also will shut off the power of that muscle. A lot of components in the shoulder area. Elbow, of course, what I just talked about as far as when you're doing pull-ups or deadlifts, cleans, things like that. Your hips are definitely something that needs to be in motion. Same with your ankles, because if you don't have the range of motion in your ankles or your hips, you're going to start to have knee trouble. And that goes just with, as far as with the elbow goes too. If you don't have the wrist range of motion or the shoulder range of motion, you're going to start to feel it in your elbow. So a question I get a lot about ART and what I do is, what if we just do mobility with the lacrosse ball or foam roller? Well, with ART and dealing with CrossFitters for a long time, I also will help you in doing the proper things to get those areas loosened up, say if your shoulder or whatever. I'll kind of point you in the direction of using the lacrosse ball a certain way. But then there are also certain areas of the shoulder or wherever I'm working that are just kind of tough to get to with a lacrosse ball or a foam roller. And also with any kind of form of myofascial release, you always want to try to work on the area that is injured and not on good tissue, because you can overmash good tissue and that can cause inflammation. So over the years with working with CrossFitters and athletes, I've been able to hone in on my ability to palpate those adhesions and be specific on the areas I work on. Just so you know, if you see me around, if I'm in a WOD with you or rolling out or anything, don't hesitate to come up and just ask me questions. I'm very happy to help anybody here at CrossFit or a friend, or if anybody has a question about anything I do, don't hesitate to give me a call or email me or stop me in the gym and just chat with me, all right?